UK, which is very much what we've been aiming to do. So what the idea is that we're going to have more of discussion, panel discussion towards the end of this session, trying to bring those themes together and actually importantly try and look at how we can work together both as UK but also across different organisations to actually be able to implement many of the things that we've just heard about from our speakers. There is another change in the programme now, in as much as Eric Lowe unfortunately is not able to join us this afternoon, so we're going to move straight on to the next section.
So to carry on with the theme, but looking at it from a patient perspective, I'm pleased to introduce our next three speakers. Louise Martinez is our patient representative from Reading, Sophie Castell, Chief Executive of Myeloma UK, and Sheila McKinley, Director of Research, Myeloma UK.
Okay, so when I was first asked to speak today, my first thought was I really hope that I'm having a well day, a good day. My second thought was when I was asked to think about the next 5 years. So that's how I actually look most days. Don't be fooled by the dress. Okay, a little bit about me. So in 2018, at the age of 42, I was diagnosed with a solitary plasmacytoma in my L2 vertebrae. I had radical radiotherapy and I got to wear a fabulous leopard print back brace. I don't know if you can see that, but it is leopard print. And then I went off on my way and hoped that that would be the end of it. December 2020, a PET scan unfortunately showed I had 5 plasmacytomas in various areas. So I started 6 cycles of VTD, which failed. I then had 2 rounds of DT PACE, and then I went on to have my stem cell transplant. Since then, I've had 18 months on KRD, and I'm currently just on lenalidomide. I say just, but none of this is very easy. Doing well is not well. Every time I see my consultant, I get my follow-up letter, and she says, I saw Louise in clinic today, and she's doing really well. And I always think, well, compared to who? I mean, I'm not dying, it's true, but compared to my friends, I'm not doing very well. My 78-year-old mother is actually more well than me. I'm just going to share you a little bit story, like a day in the life of. I'm a huge Bridgerton fan. So my friends and I, we went to Bridgerton afternoon tea here in London. Nat drove, which was great, so I don't have to worry about germs on the train. And also it's just not as tiring. As we get into Mayfair, my tummy, so I have bile acid malabsorption from the drugs. My tummy decides it wants to play up. So Nat pulls over into Double Reds. I run into probably the poshest hotel in Mayfair. There's more security in there than probably the royal family need, and the suitcases are worth more than my house. And I run in screaming the toilet. Thankfully, they let me use the toilet, so it must have been because I was wearing my best dress. And I went on to enjoy Bridgerton afternoon tea. So it's always a good day when I don't shit myself. I don't know how else to say that. Remember, doing well is not well. I asked the UK Myeloma Under 50s support group where they, what were their thoughts and where they would like to see and what they'd like to see happen over the next sort of 5 years in terms of myeloma treatment and care. The feedback was really interesting. However, in the absence of time, I'm just trying to run over some key points. There is loads more I could say, but the ladies from Myeloma UK probably won't be very happy if I take their time. One thing that became very apparent to me was these aren't things that need to happen in the next 5 years. These are things that need to actually happen now. Given that we have to stay on treatment currently, we would like better drugs with less side effects. The 2 main side effects, which won't surprise anyone, are fatigue and diarrhea, at times debilitating. There has to be an easier way because it is also about quality as well as quantity of life. And as much as we are all very happy and excited about all the newer drugs and developments, and we appreciate everyone involved in making those things happen, it would be really good to see them being approved earlier, maybe at line 1 or 2, especially given how effective they have proven to be on patients who are much further down the line and whose bodies are exhausted. Perhaps they could even replace a very aggressive stem cell transplant, which is extremely difficult for us patients to endure. And given that the average age of myeloma is, I believe, 72 or thereabouts, patients under 50, we have very different needs. We need to work, we need to parent young children, and we need to make it to 72. And not just make it, we need to have a reasonable quality of life. We need better diagnostics, that word. Better genetic testing. MRD testing as standard. So that we, along with our medical teams, we can actually make more informed decisions about our treatment plan and our care. And I know it can be done because, in fact, it is done for other blood cancers. And it's really important because this is our lives. And one of the biggest points that actually came up was the lack of emotional and practical support. Most patients reported that they weren't offered any guidance on how to support and tell their young children that mummy or daddy has an incurable cancer. And lastly, but not least, 40% of patients report ongoing issues with getting their chemo drugs on time as an outpatient. So, yes, we are all very excited about the future and what's happening. However, it has to be better today because we are alive today and we want to continue making memories with our family.